Good morning, welcome to Furry and Spoilt. The last few weeks I've been researching diabetes in dogs. And so I'm just going to go through with it now. I just wanted to make sure I was all up to date with the latest research and everything. So let me go through with you what I found. So first of all, what is diabetes? It's where the sugar levels are too high and it damages the organs, and therefore the body doesn't regulate insulin properly, or it might not even produce insulin at all. You need insulin to produce your sugar, to regulate sugar levels. This is humans and dogs. Sugar levels that are too high is very damaging for the body, and sugar levels that are too low is very damaging. So you need a nice steady sugar level, and so therefore you need insulin to do that. So the signs that a dog has diabetes are that they are thirsty, they need to go to toilet more, hungry, weight loss, low energy, cloudy eyes, and that's because the sugar enters the lens and then left that can go on to have cataracts, thin fur, skin infections. Now, if diabetes isn't detected at that point, then it can go on and get more serious. They'll start being sick, diarrhea, not eating, appearing unsteady, collapse, sweet breath that can smell like nail varnish remover or pear drops, enlarged liver, kidney failure, seizures, urinary tract infection. So you can see how it gets serious. Now, what can cause this to happen? A bad diet can cause this to happen if there's too much sugar in your diet. Now, I know, you're probably sick of me. I'm endlessly going on about bad dog food. If a dog food has got grains in it and cereals in it, and please go and look at your tin of dog food or the bag of dog food, and if it has got grains or wheat or cereals in it, it's those grains get into the body and turn to sugar, and that sugar just rises too high. And this is one of the reasons that so many dogs now are getting diabetes, because they're being fed a bad diet. Now, diabetes can look like Cushing's disease, and that's the next thing that I'm going to be researching is Cushing's disease, and I'll let you have what I find out about that. So you've got to be careful that diabetes doesn't get misdiagnosed when it's actually Cushing's disease, or the other way around. Stress can affect sugar levels because it can affect cortisol. So when you get stressed, your body produces cortisol. Cortisol can attack the insulin producing cells, and so therefore damage them, and so therefore you can get diabetes. Pancreatitis is another one because it's an inflammatory disease. In a minute I'll tell you why inflammatory diseases cause diabetes. So pancreatitis is inflammatory disease, and so that can cause it. Steroids, I hate steroids, really hate dogs being on steroids, because not only do they suffer short term because they make them so thirsty, so hungry, they can't settle down, but long term they cause so much disease and illness in dogs, and one of those diseases is diabetes. And vets just love putting dogs long term on steroids because it makes them so much money and it just causes them so much damage. The other thing that causes diabetes is an overweight dog, and I want to talk to you about this because when you go to the vets with an overweight dog, they will try to sell you a dog food that is for dogs that are overweight. You know me, if you know my channel, you know how fanatical I am about dog nutrition. If you look, this diet food that vets will sell to you if your dog is overweight is one of the worst quality dog foods I've ever seen. It is full of grains and wheats and cereals, which then turn to sugar, which then make the dog fatter and cause diabetes. So you're just in a horrible cycle. Horrible. So do not feed your dog the dog food that your vets will give you to get the dog to lose weight. And I always say, don't just listen to me. Look on the back of it. Ask to see a tin of it. Turn it over, look on the back, and you will see it's cereals and grains and wheats. It's just full of sugar. It's animal derivatives, meat meal. That's not real food. So really don't do that. The best thing you can do for a dog that is overweight is home cook your food. And I know that seems scary, and I know a lot of people are scared about it, and I've been there, but it's not that scary, and your dog will lose weight. And I'm here to help you through every stage of this. I will help you all the time, any concerns you have about it. If you go to my playlist, Feeding Dogs, and go, actually I'll stick it up at the end, the playlist of feeding dogs. I go into such detail about how to home cook dogs food, the supplements you need, all the different foods you need to make sure that you're hitting all their nutrients, all their minerals that they need, a real detail, and it really will make your dog so much healthier. Now I want to talk to you about immune inflammatory disease. So these grains and wheats I'm talking about that are in food, they cause inflammatory disease. Now let me just read from my piece of paper about this. So inflammatory disease means the body attacks its own tissue and destroys it. If the beta cells that make insulin in the pancreas get destroyed, this causes diabetes. So inflammatory disease causes the cells to get damaged and cause diabetes. And when you feed your dog grains or wheat, you are causing inflammation in the body. Right, genetics. So a 2023 study found that there was no difference between pure breeds or mixed breeds. They're all as likely to get diabetes. Females are twice as likely to get diabetes than male dogs. Right, so that's causes. So now we need to look at finding out. So if you are seeing all of those signs or any of those signs, and I know some of them are quite discreet and it would be quite hard to, you might think, well, is it, isn't it, you know. But if you think your dog does need to, you maybe a chance, you need to take your dog to the vet. And how they find out is they do a urine sample, because they need to see how high the sugar is in the urine. Because if they've got high sugar in their blood, it will show in the urine. Now, what is really important about this is that if the dog is stressed, they will have high sugar levels. And so you're going to get a false indication, because they could have high sugar levels while they're stressed, but not have diabetes. So if your vet tries to get you to have a blood test first, that is wrong, because the urine test you can do at home or out on a walk where they're nice and relaxed. But the blood test has to be done at the vet's, and most dogs will be stressed at the vet's. So therefore, you could get a false result because they were stressed and therefore their sugar levels were high. But the vets will make a whole load more money out of giving you a blood test first than they will the urine sample. So it's really important that you are aware of this and that you make sure urine sample comes first, and that is done at home. If that shows high sugar levels, then you have the blood test, not the other way around. You know how much I don't like vets. You know, you've got to go there informed, be aware of what you think your dog may have, sound really knowledgeable. If you go to a vet and you don't sound knowledgeable, they are just going to fleece you for a whole load of money. So really make sure that you get the urine sample first and then see how that goes, and then the blood test. Now the treatment for it. So first thing, well, the dog needs to go on 2 injections for insulin, which I think would be really daunting and quite scary if I had to do it. But as hard as this will be, you have to make sure that you stay calm around the whole situation with their diabetes, because you know what dogs are like. They will breathe straight off you. You're not getting any action from these two, are they? Fast asleep. No action down here, my little Albert. And you don't want that, obviously. So stay as calm as you can. Feed small and often so that you keep their sugar levels level. So the whole point of it is that you want to keep their sugar levels nice and even. If you feed them small and often, then that will help regulate that. And like I said, really important that you're not feeding them grains or sugar or anything like that. If you are home cooking them, and especially if you're doing it from my list. So I found out, I was trained to be a dog nutritionist. I found out all the vitamins and minerals that dogs need. Then I found out all the foods that you needed to give to a dog to fulfill all of those nutritional needs. And there's fruits in there, and there's things like some sweet potato and peppers. If your dog has got diabetes, you do need to give your dog a selection of fruits, and I go through it in great detail, and a selection of sweeter vegetables, but make sure that it isn't too high. And even if your dog doesn't have diabetes, you still got to be careful about when you're giving dog fruits, sweet potato, peppers, anything that's sweet. you need to make sure that the dose of it isn't too high. And I do a 70-30 ratio. So 70% of their meal is meat and fish, 30% is fruit and vegetable. But of that 30%, anything sweet, so sweet potato, fruits, and peppers, make sure that that is a really low amount. You don't want to give them too much of that. But you do need to give them some, because there are vitamins and minerals in there that they're not going to get from meat. So diet is really important. As I know it's not always easy, but as much as you can, try to give your dog a stress-free life. Now, you need to be aware of whether the injections you're giving them have got enough insulin in them or whether it needs changing. And this is by knowing whether the sugar levels have gone high or low. So low sugar levels are hypoglycemia and high sugar levels are hyperglycemia. And hypoglycemia is in the immediate time that it happens, it's an emergency. So you need to be aware of it. So if your injections aren't right and the sugar levels drop, these are the signs you need to be looking out for. So your dog may seem dizzy, so that would be leaning, unbalanced, sudden eye movements are a sign that a dog is dizzy. They could fit, they could have they could collapse, they seem disorientated, weak, and they could feel sick. Now, I'm not diabetic, but a couple of times in my life, I have had my sugar levels just drop, and you feel awful, and it's really scary. And so your dog is probably going to look very scared. This is serious, and it's not going to sort itself out. So you need to phone your vet and tell them that you think your dog's sugar levels have dropped. They should tell you to try and get the dog to drink sugar water, so just water with some sugar in it, and this isn't very easy, I would imagine, if a dog is panicking, to get fruit juice or honey onto their gums. They should tell you to do that immediately and then tell you to get the dog to the vets. If you just take the dog straight to the vets, even if that takes you only 10 or 15 minutes, that is too risky. You need to try as hard as you can to get some kind of sugar into them. Obviously not chocolate, but you do need to get some kind of sugar into them. That is an emergency situation, and you do need to do that. When the vet should then tell you to take them straight in, and when you get there, they will work out where the injection isn't quite right and sort out the amount of it, and then that should sort you out. Eating the small meals I talked about really helps with regulating the sugar level. Now, if the amount of insulin you're giving to your dog in the injections means that the sugar levels are too high, that takes you back to the beginning of where I started and the signs, because you'll be back to that point again, which again is serious. It is still very serious, but it's not the quick emergency situation that you're in if the sugar levels drop. But it is still serious, and then you need to tell your vet that you think the sugar levels are too high, and then they will take you in, and then they will sort out the amount of insulin that you're feeding your dog. So luckily none of my dogs have got diabetes, and no dog that I've ever had has had diabetes. When Humps first came to us, so he's my dog at the back, he came to us 2 years ago from Korea. He was in such a dreadful health state. I mean, he was just, everything that could be wrong with a dog was wrong with him. And his eyes was white, completely cloudy white, and he used to drink loads and loads and loads. So obviously diabetes is the thing that's triggered, but it wasn't actually diabetes. It was that he had been kept in a dark warehouse and he hadn't seen daylight, and so therefore his eyes hadn't got used to it. And once I got him here nice and stress free onto a good diet, which I put down to so much with him, the eyes cleared up. And you can't see them now, but if you know my channel, you know he has got the most beautiful brown big eyes. They are so clear, like pools, you can see straight into them. Beautiful eyes. And they just cleared all up. And the other thing was that he used to drink and drink and drink and drink like crazy amounts, and then go for a piddle and piddle enormous amounts. Again, a sign of diabetes. But it wasn't. What it was that he didn't have access to water. And so whenever he came across water in his past life, he would just drink and drink and drink and drink and drink. And then obviously that would just make him go to toilet loads. And he doesn't do it anymore. But for the first probably 6 months of living here, he would, even though there's water bowls all over the house and it's always fresh and he has access to them 24 hours a day, he was still doing it for a while. He would drink and drink and drink and drink and drink, and it used to worry me that he was just going to choke on it. So when he was doing it, I should maybe call him and try and distract him, and then he would go out and piddle and piddle and piddle. But what I found was when he was doing it, I started let him have a drink. But then when I could see that he was getting a bit excessive, I'd call him away and distract him. And he very soon learned that he didn't have to drink like that. There were bowls everywhere, and it was just a habit he needed to get out of. So sometimes the signs of diabetes don't mean diabetes, but it still needs to be taken very seriously and not something to be messed around with at all. So that's diabetes. So like I said, because diabetes and Cushing's disease look incredibly similar, I'm going to be researching Cushing's disease. I don't know much about Cushing's disease, actually. So I'm looking forward to doing that and finding out all about that. If you've got any questions, put them into comments, and especially about their diet, because I know all about that. I can tell you all about that and help you with that. And any minute, the list will come up, the playlist will come up for feeding dogs. So if you want to understand what's on the back of the ingredients of your dog food, or if you've had enough of dog food and you want to go home cooked, all the videos are in there to help you with all of that. But you can ask me any questions at all that you want to. I'm over on TikTok. Instagram, I'm not doing much on Instagram these days, but you can contact me through the Instagram messaging. I do keep an eye on it. But I'm on TikTok a lot over there, teaching people at the moment how to make home cooked dog food. So that's where I am most of the time. But if you're not on TikTok, you can get me on Instagram, or just put anything you want in comments here. So that's it. So hopefully your dog won't get diabetes. If your dog has got diabetes and you've got anything you want to add to this, please do, because it will benefit us all to learn about it. So thank you very much for watching. There's not really a lot going on here today, is there? They've had their walk, they've had their breakfast. That's them conked out till lunchtime. So thanks for watching. I hope you have a great day, and I'll see you in the next video. Bye bye.